Welcome to Julik Channel. Welcome po kayo guys sa aking YouTube channel. Ang channel pong ito ay nakapagbibigay ng dagdag kaalaman sa ating lahat. I am very thankful to my beloved subscribers and to all supported viewers in my videos. Thank you so much. If you are not willing to learn, no one can help you. If you are determined to learn, no one can stop you. Kaya, kung hindi ka pa nakapag-subscribe mga ka-viewers sa aking channel, just click subscribe and click the bell. Asthma flare-up. This is the normal way. Asthmatic airway. Asthmatic airway during an attack. Asthma flare-ups. Keeping an asthma under control helps kids avoid breathing problems. But sometimes asthma symptoms get worse, making kids wheeze, cough, or be short of breath. This is known as an asthma flare-ups, also called an asthma attack episode or exacerbation. But sometimes asthma symptoms get worse, making kids wheeze, cough, or be short. Keeping asthma under control helps kids avoid breathing problems. So struggle to breathe or have rapid breathing even when sitting still. Be unable to speak more than a few words at a time without pausing. Have retractions or sucking in of muscles in the neck and chest while breathing. What happens in asthma flare-up? In the lungs, airways let air in and out. When someone has asthma, these airways, also called bronchial tubes and bronchioles, might be slightly inflamed or swollen even when the person seems to be breathing fine. During a flare-up, the inflammation gets worse, sticky mucus clogs the airways and their walls get more swollen. The muscles around the airways get tight, further narrowing them. This is called bronchoconstriction. This problem leaves very little room in the airways for air to flow through. Think of a straw that's being pinched. So the causes of asthma flare-up. People with asthma have airways that are overly sensitive to some things called triggers. Being around triggers can be on asthma symptoms. Common triggers include tobacco smoke, cold air, exercise, infections such as colds, animal dander, dust mites, molds, cockroaches. Many people with asthma also have allergy for them. Allergies, the things that cause the allergic symptoms, also can cause asthma flare-ups. If not treated, a flare-up can last for several hours or even days. Quick relief medicines, also called rescue medicine or fast-acting medicine, often stop the symptoms pretty quickly. A person should feel better and the flare-up ends, although this can take several days. So here are the signs of asthma flare-ups. Asthma flare-ups can vary in strength and length. They can happen without warning, causing sudden coughing, shortness of breath, and wheezing. But because people with asthma have inflamed airways that get worse with gradual exposure to triggers, flare-ups also can build over time. especially when asthma is not well controlled. Flare-ups should be treated right away, so it's important to know their early warning signs include coughing, throat clearing, rapid or irregular breathing, being very tired, trouble doing everyday activities, restless sleep or coughing that prevents sleep, mild chest tightness or wheezing. A peak flow meter can help predict a flare-up, but not all flare-ups can be prevented. Because they can be life-threatening, flare-ups demand attention. Your child might need to take quick relief medicine, which acts quickly relieve symptoms, visit the doctor, or even go to the hospital. Following the instruction in your child's asthma action plan can help you to know what to do when a flare-ups happen. So the prevention to help to prevent flare-ups, make sure your child always has quick relief medicine available. Teach your child how to avoid asthma triggers. Make sure your child takes long-term control medicine, also called controller medicine or maintenance medicine, as the doctor directed, even when your child feels well. It's important not to skip it. Make sure your child gets a yearly flu vaccine and washes his or her hands well and often to avoiding germs that lead to colds and other illnesses. Work with the doctor and an effective asthma action plan. So, exercise induce asthma. Most kids and teens with asthma have symptoms when they exercise, but some people, including those who don't have asthma symptoms only during or after exercise. This is known as exercise-induced asthma, also called exercise-induced bronchoconstrictions or AIB. Signs and symptoms of exercise-induced asthma. Symptoms of exercise-induced asthma include wheezing, tightness or pain in the chest, coughing, and in some cases, lasting shortness of breath. Someone with exercise-induced asthma may get winded or tired easily during or after exercise. Cough after coming inside from being active outdoors. Not be able to run for more than the causes of AIA or exercise-induced asthma. Inhaling cold dry airways laser is thought to be the main cause of AIA symptoms. When the kids exercise or play hard, they tend to breathe quickly, swallowly, and through the mouth. So the air reaching their lungs misses the warmings and humidifying effects that happen when they breathe more slowly through the nose. The dry air makes the airways and the lungs narrower, which blocks the flow of air and makes it harder to breathe. This is called bronchoconstriction. How is exercise-induced asthma diagnosed? A doctor will ask about the family's asthma and allergy history and about the symptoms and what has triggered them in the past. After taking a medical history and doing a physical exam, the doctor may ask your child to take a breathing test after exercising. This can be done in the office on a treadmill. After your child runs outside for 6 to 8 minutes or after doing an activity that's triggered flare-ups in the past. So, how is exercise-induced asthma treated? Doctors sometimes recommended pre-treatment for EIA. This means taking medicine before exercising or being very active. The medicine often is the same quick relief medicine, also called rescue or fast-acting medicine, used during flare-ups. Taking it before exercise can help prevent the airways narrowing triggered by exercise. If pre-treatment doesn't control symptoms, the doctor may recommend using long-term control medicine. This asthma medicine is usually taken regularly over time to reduce airways inflammation. If your child still has breathing trouble during exercise, let the doctor know. The medicine dosages may need to be adjusted for better control.